Jerry Brown here with Jerry Brown Travels.
And Valerie Friesen here from Blue Angel Solutions.
Today we're going to have a special interview. We've been getting a lot of requests. People want to know about private insurance in Mexico. Okay, so now Valerie specializes in medical care here in Mexico and different programs that's available for expats. Is most of your business with expats?
Yes, it is. And basically retired expats of every age.
Valerie, a lot of people are really concerned about private medical insurance coming down to Mexico here. And I know there's just a lot to cover with that. But could you give them a little idea of basically what it would be? I think what we're trying to do in this video is for you, the viewer, to be able to know that you have a contact person here, Valerie, and she can answer any of your questions in depth. Or if you're down here in Mexico, in the Lake Chapala area, you set up an appointment with her. But what would be just a basic little thing that they should know before they contact you? Give us some, let's say I walk into your office, you know, somebody new, and what would be the process that you would go through with them?
Essentially, it's a short, let's get acquainted conversation. What kind of insurance are you looking for? Are you looking for a travel plan or an annual plan? Clearly, that's of significance. And secondly, and related to that is what kind of Mexican visa do you have? Because essentially we're offering the annual plans to residents of Mexico.
So that would mean that they would have to have a temporal visa or a permanent visa, but they couldn't come down, fly down and use that visa, which is your 180-day visa. You can't qualify.
No, those are classified as the tourist visas. Now, they can those individuals with that visa certainly can qualify to purchase travel insurance for their visitation here.
Okay, good. Now, how long have you been in business?
The industry since January 25th, 2010.
2010, okay. Give them an idea of what, you know, what they can expect, you know, with a policy, you know, how it works, and yeah, just a breakdown on that.
Okay, well, that's clearly what people are looking for. Are, as you stated earlier, our customers are expats, normally retired, and mainly from Canada, the US, but certainly more and more we're getting individuals from different parts of Europe and occasionally from Asia. And so in addition to determining, yes, they're residents, an important factor is what is your age, because all health insurance products have a maximum age to apply. And that's important to understand because once you're over, there isn't really much we can do to help you. The second other area that's very important, every private health insurance company, everyone has a list of what are considered non-insurable conditions. And we're sad to say, but the door is closed. We can't do anything about that. So rather than waste somebody's time getting them all excited about the wonderful benefits that we can offer, we like to cover that off right at the front.
So are you talking about pre-existing conditions?
Yes.
Okay, so the insurance companies are not providing, would they need to then take a physical?
Well, the kind that I just described are non-insurable, so that means they will, their hand is saying, do not enter. We will not entertain an application from you, period.
Okay.
So a great example is diabetes type 1. Nobody covers that. except the Mexican government insurance.
Okay, so no pre-existing conditions,
Of a certain category.
certain category, okay,
Yes.
okay.
So let's take other pre-existing conditions. A general, simple definition is, have you had surgery for a particular condition in your life, not just in the last 10 years, or are you taking ongoing medication? Those are the two quick and dirty definitions of pre-existing.
Okay, good. Now you mentioned age as a so I imagine the premiums are at a different cost based on your age.
Well, they're basically, generally speaking, you are correct. The products that are full major medical are age loaded. Most of them go in 5-year increments. So let's say 55 to 59, then the next jump is 60 to 64, 65 to 69. That's a big jump for all insurance policies when you hit 65.
Okay. Residents of Mexico private medical insurance.
And those individuals who live here and have a Mexican visa, temporal or permanente, and those are full policies. In general, the maximum age to apply would be 74 years for the full annual policies. There's a variety to suit your budget, so as to speak, and we always provide a written quote, and that explains the options, and then follow up with a telephone call or an email to address any outstanding questions. Opportunity to select the payment frequency plan that you would choose, from once a year, semi-annual, and quarterly, and occasionally on a monthly basis. Lots of flexibility through debit or credit card or wire transfer. It's your preference and your convenience.
Travel insurance that covers the COVID-19 as you're traveling, Mexico or anywhere in the world.
By the way, one of the medical travel insurance carriers that we have will provide coverage for COVID-19 at this time for all travelers 74 years and under. So at this point, that gives great peace of mind for Canadians and Americans who want to come down for a vacation, and that's a great peace of mind option to offer.
Okay, and then just for our viewers there, if let's say they can't afford medical care in the States, it's just gotten priced out.
Well, definitely, in addition to the beautiful weather and wonderful people, a strong reason for many retirees from North America and increasingly Europe is the good quality of the medical care and the professionals for the doctors and the hospitals, but as also the significantly reduced costs. It will vary. It could range to a 20% reduction to a 50%. That requires a more detailed conversation about your desires and your budgets.
Okay, great. So the information on Valerie is down below in the description area. Feel free to call Valerie, email her, and she can get back with you, and you can get into a phone conversation, or if you're here, make an appointment, that's even better. And she can go over all of the details of having private insurance. She will sit down with you or she'll call you, and she's very thorough and giving you first-hand, up-to-date information.
And it's changing all the time.
Right. Yes, they did. Well, thanks, Valerie. Appreciate your time, and we'll pass this on to our people and see if they want to give you a call.
Hasta luego.
Adios.